Hello guys, welcome all of you to today's PHARMCAST. Today we'll discuss 5 drugs of choice, 1 anti-cancer drug, and many questions asked by the students. Yes guys, gradually what's happening is the questions, number of questions that you guys want me to discuss, it keeps on increasing, right? So today I have at least 7 questions that I have to discuss. So I have thought of incorporating all of them. Anyways, so it might be a longer session today, right? So let's begin with our drugs of choice, guys. So the first one is carry-on or tinea capitis. So see, carry-on, if it is overall, if they ask you the drug of choice for carry-on, then your answer would be griseofulvin, right? Griseofulvin is the overall drug of choice for carry-on. Specifically, if they ask you trichophyton, see, in trichophyton, griseofulvin and terbinafine both are equally effective, but the traditional drug of choice is still griseofulvin. So you need to remember, in trichophyton causing carry-on, terbinafine is an equally good alternative. But if it is microsporum, then only griseofulvin is used because terbinafine is not as good as griseofulvin. So nevertheless, guys, overall, remember, carry-on, the drug of choice is griseofulvin, right? Coming to the second disorder for today, that is, guys, Klebsiella. And Klebsiella, as I have already said many times, most of the gram-negatives drug of choice is ceftriaxone, except few like Pseudomonas, Enterobacter, Acinetobacter. For these, ceftriaxone is not effective, right? Third disorder for today, guys, Legionella, which causes atypical pneumonia. Now remember, Legionella, the drug of choice is obviously azithromycin. But apart from azithromycin, if you don't have it, then you can also use levofloxacin, is an equally good alternative to Legionella, and doxycycline can also be used. So Legionella, 3 drugs are preferred: azithromycin, levofloxacin, doxycycline. The preferred one is obviously macrolides like azithromycin. The fourth disorder for today, guys, it is Leptospira, causing leptospirosis. So guys, the traditional drug of choice for leptospirosis is, as all of you know, penicillins are the drug of choice. Penicillin G is the drug of choice, and alternatives, we can use doxycycline or azithromycin as well for treatment of leptospirosis. The last disorder for today, guys, it is Listeria Meningitis. See, Listeria Meningitis, usually if you look at meningitis, then for most of the meningitis, the drug of choice is ceftriaxone, right? Like H influenza, meningococcal, etc. But one meningitis where ceftriaxone is not active is Listeria, and here the drug of choice is ampicillin. So Listeria meningitis, guys, remember, drug of choice is ampicillin. Now we have come to the second part of the PHARMCAST, where every day I do discuss one anti-cancer drug or a class of anti-cancer drug. Today I'll discuss a class of anti-cancer drug called as nitrosoureas, like carmustine, lomustine, samustine. First of all, think, which class of anti-cancer drug do these belong to? They are alkylating agents, right? So these are alkylating agents, and the good thing about these drugs is they are highly lipid soluble, and that is why they can cross the blood-brain barrier. And it's quite obvious they would be then used for treatment of brain tumor. They used to be the drug of choice, but not now. Now the drug of choice for brain tumor is another alkylating agent that is called as temozolomide. Temozolomide is the drug of choice for brain tumor. And why these drugs, they have fallen out of favor for treatment of brain tumor is the side effect, which is sustained neutropenia. Neutropenia is a side effect of these nitrosoureas, right? Alright guys, and now we have come to the last part of the PHARMCAST, where I discuss all of your queries, and today I have 7 queries, guys, yes. And I've incorporated all of them in the PHARMCAST. Question number 1, a student has asked, I don't like to revise from flowcharts. So I had advised you to make flowcharts for revision of huge topics, right? And this student is saying that I don't like to revise from flowcharts, I like to revise from my notes, but I don't know what is important to focus in the notes. So if you look at your notes as a whole, then you might not find which one is important, which is not important, just like that. And that is the reason why precisely I ask you guys to make a flowchart. Then you would be forced to find out which are the important points. but usually you won't do that hard work if you don't make a flowchart, right? But nevertheless, if you don't like to make a flowchart, then see what is the way out. While you make your notes, you must have marked the important points that the faculties they highlights or they point or they tell, or if it is not there, then you might have come across the points which are repeatedly asked in exams, right? For example, say, let us talk about valproate. See, in valproate, if I talk about what I need to focus mostly where it is drug of choice and what are the side effects, because both are important. But phenytoin, if you look at the uses, it is not drug of choice for anything. So uses are never asked. So I need to focus only on side effects. Similarly, for example, lamotrigine, they mostly ask you on mechanism of action, right? Because it has 3 mechanisms of action and 1 side effect, that is Stevens-Johnson syndrome. So while you study your notes, if you have studied your notes well and you have correlated to the Q bank when you solve questions and repeatedly questions are being asked, so you would see that mostly they ask you either on drugs of choice in epilepsy, or they ask you on the side effects. And which are the drugs they ask you side effects? Is either valproate, is either carbamazepine, or is it is phenytoin, right? So that's the kind of, you yourself have to develop this ability to pick up in the notes which are important, and plus faculties, if they help you while they mark these points, that is what you need to revise, right? And it usually, it usually comes up in the second revision. So while you do your first revision, you're still clouded, you revise everything, and then you mark those points, and you definitely should mark those points or make flowcharts, which will make your second revision easier. So yes, the first revision is actually not that difficult as compared to the second revision, because second revision is where you need to revise the same content, but in lesser time. So that is more challenging, and you should be prepared for that. How you prepare for that is a different story. I've told you, make flowchart or make some diagrams, whatever you want to do, right? Coming to the second question, a student has asked, sir, I had got 1800 rank in AIMS and I might not get a seat, whatever I desire in these AIMS counseling, and what should I do now? Should I do the revision modules or the test and discussion videos, or what should I do? See, it's very simple. I would rather ask you to, ask yourself, what got you this 800 rank? So you have got till this 800 rank, right? So what got you this 800 rank? You know the answer, right? So you know what has got you here, and now what you need to do is you need to repeat the exact same thing till the next Central Institute exam, that is the INICET, right? And you just imagine if you can revise your notes and couple it with daily MCQs practice, right? You'll be able to get under 100, right? So the thing that is working for you, why would you like to change that? Are you getting my point? So you need to revise that again. That would increase your efficacy, guys, and decrease your error margin in the exam. Rest, what you have asked, like revision videos, you should not go for the total revision videos, because you will study, then when you get the time to revise. But you can use it judiciously. Like suppose there is a topic like acid-base disorder, or suppose there is a subject, a short subject like you're not comfortable with, like radiology or any other subject, right? So you can just go to the revision videos and brush up those topics. So revision videos, they are like killer if you use them judiciously and based upon your position. What might work for somebody might not work for someone else. Are you getting my point? Now guys, moving on to the question number 3. The student has asked, so in grant test, many questions are from the Q banks and I mark them correct, but I feel I'm not testing myself. Is NEET also same like that? I'll get repeats. So yes, if you look at the exams, you would have seen in your exams or grant tests, whatever you give, you take the 10 years paper. So many of the topics, right, like 70 to 80% of the topics, they are continuously repeated. They're the same topics, but they might ask you the different aspects. 20%, plus minus 5%, it always keeps on changing on different things. So what you need to do is in any of your exam, right, the amount of repeat, it was huge earlier, but after the NEET exam, the repeats are not that much. They are less than 10% repeat, but still they do count, right? Like in pharmacology, drug of choice, that is not going to change. Some change, but most of them, they are the same drugs of choice. So whenever they ask you a treatment or drug of choice, it will be the same MCQ. They might change the language. It might not be the exact repeat, but you know what I'm getting. So don't worry about that, guys. Even if there are repeats, and even it is a bigger task, that for all those repeats, your accuracy should be 100%. If you are preparing seriously, it should be 100%. So that is how it should be. So don't worry about that. Question number 4, guys. I'm doing revision but not able to review grand test. What should I do? See, if you remember, I have already covered this. Like, what should I do about reviewing grand test? See, if you're asking me like, what should I choose between? Because I'm in short of time, I don't have much time, and I have two things: notes revision versus grand test review, and I have to choose one. Then obviously, guys, you know my answer. I'll choose notes over grand test revision if I'm in shortage of time and I cannot devote too much time to grand test. Nevertheless, I'll tell you what you can do is allocate a specific time, like say 3 hours or 4 hours to your grand test review, and don't do everything. Don't do everything. Just try to briefly and fast cruise through those questions which you have done wrong, right? And that is one thing you can do. And even if you cannot do that, not to worry, guys, because you cannot do everything in this world. And there might be some other people who are able to do it. You are not able to do it. It does not mean that you are wrong. Because see, what some things might work for someone might not work for you, and you might not be able to do that. The reason being you are you have lesser time for revision, right? So everyone should have a strategy based upon his or her priorities, right? Coming to the next question, guys. I'm preparing with a side job, and I get 4 to 5 hours to study. That too, I am very tired. My percentile is around 30, and what should I do? See, I'll tell you a realistic picture. And I was in your position one day, and I also had financial issues, so I tried to study with a job. But frankly speaking, I was never into it. Means I could not develop that interest or agility to prepare. And I realized that one important thing is that with whom am I competing? Because when you are giving a competitive exam, right? It's not a first come first basis, right? You have to fight it out and snatch your seat from someone else. And I realized that my competition is with guys who are studying 24/7. They are 24/7 dedicated to this. And I can't beat them with a job and a preparation. And because it would be like a fight with I'm having a wooden sword and someone is having a metal sword. Are you getting my point? So then what I did is I devised a plan. So you always have problems, guys. So solving a problem begins with, first of all, accepting it, then planning a solution. So I devised a plan. I worked for 1 year. I saved around 2 lakhs at that time, and then I sat down for serious preparation 24/7, and there was so much at stake for me that I had to reinvent myself, refocus myself. And there's one option you can go for, right? Like you can work for say 6 months, 8 months and accumulate some money and then go for the kill. And the second option, obviously, what you're asking me is there any hope in this little time left? See, there is always hope. There is always hope. And if you ask me what you can do in this little time, then practically speaking, you would not have time to go through all the videos and Q banks and notes at this time. So your best bet would be to just focus on the Q bank and try to solve as many questions as possible and going through the explanation as well. So guys, if you don't get through, right, in this exam, if you even don't get through, then don't be harsh on yourself, because you have not utilized your complete potential, because you are working and you are studying and you are competing with guys who are studying 24/7. So it's not a fair competition, to be fair, right? So you can, save some money and then go for the kill next year, and you will definitely get through, right? Coming to the next question, guys. My first revision is okay, but when I revise second time for the volatile subjects, I don't feel interested. So this is he's asking about what I said you guys to how to revise the volatile subjects. Like today I'll study, I'll revise tomorrow for 20 minutes, then day after tomorrow for 10 minutes, the same thing, right? So I'll tell you the mathematics behind this. See, if you know the physiology of long-term memory, right? What is the basis of physiology of long-term memory? In one word, I can say repetition. So repetition is the basic key for long-term memory. And for revision, let us say you studied 4 hours something, and next day I have asked you to revise it for 20 minutes, right? But you are not feeling, interested in revising those for 20 minutes. Next day you are able to revise it in 20 minutes because yesterday you studied for 4 hours. But he will ask you to revise the same thing after 2 months, give it a break, then you will take at least 2 to 3 hours to revise that 4 hours matter. But what you are gaining here is you are able to revise a 4-hour matter in just 20 minutes just because you have studied yesterday. So guys, what I'm giving you here is an option to do a repetition with a fair smaller chunk of time, right? So that's a win-win situation, and you have to understand that. And you will understand this when you'll continue it for 1 month. So believe in me and continue this routine for 1 month, and you will see. What this does is, actually I'll tell you practically what it happens is, when you do this kind of revision, right, it's triplet revision, 4 hours, then 20 minutes, then 10 minutes, keep on revising, then actually after 1 month, you can actually close your eyes, right? And you can flip through your pages in your mind. Now that is the kind of situation you can actually reach. I would say it is salvation in these volatile subjects. When you can flip through the pages of your notes in your mind, that is when you know that you have nailed it, guys. You have nailed it, and it will take time. It won't happen like in next 2 or 3 days. It will take you 1 month, and after that you will see the magic happen to you. So believe in that magic, guys, and keep revising. The last question for today, guys, it is a bit different from what we discuss every day, because every day whatever I discuss is related to your preparation, right? But this question I have included it here because I think if my few words can give solace to someone, why not bring it on? So this is about a girl who has already given the NEET PG. So it's not about NEET PG. Let me tell you first of all that. And she's the first year MS OBG resident, and she says, "Sir, I am of calm nature, but I am asked by my seniors to be aggressive with patients, talk loudly and shout at them. And she's also being bullied by her seniors who are second year PGTs. She's feeling depressed, and I can imagine how she might be feeling, as if that one day feels like 1 year when you have no friendly faces around you and you still gotta spend those time, right, giving your best at your work." So dear, first of all, I'll tell you something. Our society is not perfect, and that is one thing, and in our medical society I'm not very proud of, because I have seen that firsthand in the medical field, right, during my internship and when I was a non-academic junior resident. But the thing you need to realize is you gotta be strong, and if you're having crying episodes every day, and if you're feeling depressed, and if you're getting evil thoughts in your mind, right, then please, I'll ask you, do consult a psychiatrist and see if counseling or SSRI, like fluoxetine, is an option, because it is a wonderful drug. It's a wonderful drug, and often I have seen that we don't, right, we are doctors, we like to prescribe drugs, but we don't want to take drugs. But just imagine if taking a drug, right, if taking a drug makes you better, then why not take it? So I'll tell you what, taking an SSRI will make you more confident, right? It would remove all symptoms of phobia, etc., what you have, and it'll help you to fight all these adversaries as well. So that's one option that you have. I wish I could talk to your second year PGTs and explain them, but it is not my place to guide them, because I'm not in that field, and this kind of, I'm helpless. I would like to help you, but that's not one. So the only way I can help you is this, and I'll take this opportunity like to tell you that living is always an option, right? But it is not the only option. And as I always say, whenever there is a problem, first of all, you need to acknowledge that problem. Once you've acknowledged, the second step is to find a solution, right? So you've acknowledged you're having this problem, and then you try to find out, are you depressed because of it? If it is a yes, if there is depression, then we need to find the solution. Are you getting my point? And then you can move ahead. And I'd also like to tell all of you guys who are listening to me, please break this chain of narcissism, right? What do I mean by that? What happens actually is we try to met out the same treatment that our seniors give us, as if it's kind of a culture, right? So for example, if the way I was treated by my second year, when I become second year, I feel obliged to give the same treatment to my first year when he or she comes, right? So guys, no matter what kind of treatment you receive, right, make it a pledge today that you won't treat your juniors the same way and break this evil chain. At the end of the day, all of us are humans first. Then seniority, juniority, your batches, medals, everything, your degrees, they come later, guys. Now this is one thing we have failed to realize in the Indian medical system. But abroad, I would like to say that things are pretty much better as compared to our Indian system. And so yeah, this is a bad thing, and I hope it changes with time. And sooner than later, we should realize that a junior is not an opportunity, right? Right? A junior is not an opportunity. Rather, a junior is a responsibility, right? And the way you treat him or her, right, might change him or her as a person in total. So dealing with a life here, guys. So be judicious, be kind to your juniors, and let us all of us try to make this system healthier, because there are a lot of other factors. We doctors, we have to deal with, right? Let us at least not be a problem for our colleagues. Let us be the last one who should create some problem for our colleagues. So guys, that's all I would like to say for today, right? This last point is what I really feel sad about. I really feel sad about her, and I wish I could do something more. So that's all for today, guys. If you have any doubts or queries, you can always let me know in the comment box, and I'll be more than happy to include your doubts in my PHARMCAST, no matter what kind of doubts you send me, right? So take care. Bye-bye. This was Dr. Ranjan with you.